If your child's fears and worries are spiraling out of control and impacting their physiological functioning, your child might have anxiety. Children experience anxiety just like adults do. However, depending on the age of your child, he or she may not have the language to express it. So whereas some older children may be able to say, "Mom, I'm feeling anxious," or "I'm feeling nervous," younger children often express their anxiety with physiological symptoms like headaches or stomach aches. It can also manifest as avoiding activities that they used to enjoy. While it may be alarming for a parent or a caregiver to see that your child is experiencing anxiety, there's actually a lot that you can do. One thing that parents and caregivers can do is normalize the experience of anxiety by letting your child know when you're feeling anxious, the types of things that you feel anxious about, and what the anxiety feels like to you. And then you can demonstrate for them the things that you do to calm down, like, "I'm going to take some deep breaths," or "I'm going to go for a walk outside." You can even invite your child to join you. Something else that you can do as a parent or caregiver is try to encourage your child to continue doing the things that they feel anxious about. Anxiety can actually get worse when you avoid the things that provoke it, so encouraging your child to do the things that they feel nervous about can actually help them to overcome their anxiety. Parents should consider seeking additional help when anxiety goes on for more than a few months at a time. So for example, while it's normal to feel nervous about going back to school or a test coming up, if that anxiety continues beyond the event that provoked it, it may be time to start thinking about getting help. Additionally, if your child's anxiety is so severe that they're frequently complaining of stomach troubles or headaches, it's a good idea to get help for them. And lastly, if the anxiety stops your child from doing things that they enjoy or things that they need to do on a day-to-day basis, it's a good idea to get help for them. Parents and caregivers seeking help for their child's anxiety should first reach out to your child's primary care provider. This is somebody who already has a relationship with your child and knows him or her well, so they'll be able to provide you with a referral to a provider who will be a good fit for your child. Unfortunately, in today's social climate, there can be a real stigma around seeing mental health providers. It's important to remember that everything that is shared with a mental health provider is completely confidential, including whether you and your child ever met with the mental health provider in the first place. So I would strongly recommend reaching out to a mental health provider if your child is struggling with anxiety, because they can be a support system for both your child and for you.